everyone, and welcome back to Medigap Show. I'm your host, Holly Cohen, licensed independent broker. Today we have a riveting lineup as we dig into some Medicare Advantage news that is making waves across the Medicare world. The articles I'm going to read will shed light on fraud, criminal indictments, and even a class action lawsuit with a large, well-known Medicare Advantage insurer. This is the kind of information you only find on a place like YouTube. Because on the big news channels, they are constantly airing ads that have you call in to change to a Medicare Advantage plan. The majority of those commercials that you're seeing this time of year are about Medicare Advantage and for you to call in. So those news channels are not necessarily going to report on the bad information about Medicare Advantage because they're being sponsored financially through advertising. Listen, mainstream media is a business. So when you watch the news and you see those commercials, you do need to understand that the majority of those commercials are only speaking about Medicare Advantage plans. When they want you to call in, they say all Medicare beneficiaries, but really they're trying to get you to go on to Medicare Advantage. Now, let me explain quickly, and I know most of you know the biggest difference between original Medicare and Medicare Advantage is that original Medicare is administered directly by the federal government. Medicare Advantage, on the other hand, is a replacement for your original Medicare. It's no longer managed by the federal government. Advantage plan insurance companies then manage your health care. So let's kick things off with a very eye-opening report from The Hill. This expose reveals a startling issue of overpayments within Medicare Advantage, suggesting that for-profit insurers are potentially pocketing between $88 to $140 billion annually.
And policymakers are in different ways both responsible for the health and well-being of patients. While physicians care for patients to the best of their ability, policymakers ensure that the structures that make up the healthcare system are effective and equitable. Whenever and wherever there is a threat to these goals, both groups have a role to play in recognizing and combating it, while we are speaking out on the need to make fundamental changes to the Medicare Advantage program. MA, as it exists today, is a threat to patient care, to health equity, and indeed to the integrity of our public health infrastructure. A new report from Physicians for a National Health Program, an organization of doctors working to reform the healthcare system, shows that for-profit corporate MA insurers are overpaid anywhere from $88 to $140 billion a year. That's money coming out of patients' and taxpayers' pockets. Medicare is the privately run version of the traditional government-administered Medicare program. Instead of paying directly for care, the government instead pays insurers to, quote, manage patients' needs. Enrollment in this program has grown significantly over the past 2 decades, with over 50% of eligible beneficiaries opting for an MA plan in 2023. Unfortunately, growth in the program has not led to better care for beneficiaries or a better deal for taxpayers. This is all reported on our channel. Just the opposite, in fact. Tens of billions of taxpayer dollars are being siphoned off as profit by insurance companies that don't even provide necessary care. That money doesn't just cost our government, it costs seniors. For example, premiums paid for Medicare Part B, which covers most medical services outside of hospitalization, totaled $131 billion in 2022. With the amount of extra money that corporate insurers get from the government, we could totally eliminate Part B premiums and still have money left over. Where is all this money coming from? It's complicated, the result of a tangled web of loopholes, policies, and practices that are difficult for an individual beneficiary or physician to see. Even so, scholars and regulators have identified a few major factors that lead to overpayments. For example, insurance companies in MA tend to enroll patients that are healthier and therefore cost less than average, but still get paid as if their patients were much sicker. This is called favorable selection, and by some estimates, it could cost as much as $75 billion a year in extra payments. because Medicare gives additional money to MA insurers for patients with more severe or more numerous diagnoses. Another source of overpayments are the irrelevant or old conditions that insurers record on patient charts. This practice is known as upcoding. These conditions aren't being actively treated, so they don't cost the insurance company anything, but they do lead to as much as $20 billion in extra payments. These methods only scratch the surface of all the ways in which MA insurers take advantage of the system. But the bottom line is clear. These companies are pocketing billions of dollars that belong to Medicare beneficiaries. Of course, it isn't just about the money, it's also about patient care. Medicare Advantage plans tout their low premiums and extra benefits, but often these are only worth it as long as you're healthy. If you get sick and need complex or significant care, plans start to show their true colors. Difficult authorization processes and narrow networks can make getting treated under an MA plan a nightmare. In fact, high-need patients with chronic conditions and patients in their last year of life are substantially more likely to switch out of MA and back to traditional Medicare, tired of having to justify each and every needed procedure or medication to their insurance company.
Now, we're going to turn our attention to a legal matter. Fierce Healthcare spotlights legal entanglement over AI-based denials in Medicare Advantage claims. Picture this: healthcare decisions influenced not by humans, but by algorithms.
This is from Fierce Healthcare, a major insurer hit with class action over alleged use of AI to deny Medicare Advantage claims by Paige Minnemeyer, published on November 15, 2023. A major insurer is facing a potential class action lawsuit following allegations that it used an algorithm to deny claims for post-acute care services in Medicare Advantage MA plans. The proposed class action was filed Monday by the families of two deceased MA Medicare Advantage members who argue that the insurer illegally deployed the NaviHealth platform to deny medically necessary care to seniors. The lawsuit said the technology has a 90% error rate. The plaintiffs allege that despite that higher error rate, the insurance company continued to deploy the technology because a very small number of members, less than 1%, generally appealed denied claims. Defendants bank on the patient's impaired conditions, lack of knowledge, and lack of resources to appeal the erroneous AI-powered decisions, they said in the lawsuit. The suit comes on the heels of an investigative report this week from STAT, which dug into the use of NaviHealth. Employees at the insurer were pressured to use the technology to cut costs, STAT reported. In a statement to Fierce Healthcare, a spokesperson from the insurance company said the platform is not used to make decisions on coverage. The lawsuit claims that the NaviHealth's Predict tool determines the member's eligibility for post-acute care coverage based on rigid and unrealistic predictions for recovery. The tool predicts how much care a patient should need according to the lawsuit, which can lead to override physicians' determinations on what their recovery requires. Through this, UnitedHealthcare's post-acute care claims denials have increased significantly, according to the suit. The fraudulent scheme affords defendants a clear financial windfall in the form of policy premiums without having to pay for promised care, while the elderly are prematurely kicked out of care facilities nationwide or forced to deplete family savings to continue receiving necessary medical care, all because an AI model, quote, disagrees with their real-life doctors' determinations, the plaintiffs wrote. The lawsuit also follows increased scrutiny of insurers' potential use of artificial intelligence and algorithms to deny member claims.
So our last article we're going to look at is from WilmerHale's Insights, where criminal indictments related to Medicare Advantage fraud are brought to light. This is not your run-of-the-mill financial discrepancy. We are talking about legal consequences that extend beyond the dollars and cents. So join me as we sift through the evidence in this article, shine a light on a specific case of fraudulent practice.
Criminal indictment for Medicare Advantage fraud. This is posted on Wilmer Hale, published on November 17, 2023. U.S. Department of Justice recently announced a rare criminal indictment involving the Medicare Advantage program, a contrast from the DOJ's more typical use of its civil enforcement authority to pursue similar issues under the False Claims Act. The indictment alleges that from 2015 to 2020, a former employee of a Florida company that administers Medicare Advantage plans falsified and caused others to falsify diagnoses that were submitted to the Centers for Medicare and Medicaid Services, CMS, which is Medicare, and that resulted in millions of dollars in overpayments. The indictment comes as the DOJ has pledged to increase investigations related to fraud involving Medicare Advantage plans, notably consistent with the DOJ's recent pronouncements regarding self-disclosure, cooperation, and remediation. The DOJ declined to prosecute the former employee's company. In exchange for managing these beneficiaries' care, CMS prospectively pays, that's Medicare, pays a monthly amount for each enrollee. These monthly per-member payments to each plan are adjusted based on its enrollee's age, gender, and health status, a process known as risk adjustment. To determine plan enrollees' health status, CMS relies on diagnoses reported from patient encounters. These diagnoses are reported to CMS using a standard of codes that trained medical coders assign based on the conditions documented by the provider in the medical record for the patient's visit. In short, Medicare Advantage plans receive more money for sicker patients who present a higher risk of greater future health expenditures, and conversely, plans receive less money for healthier patients who present lower risk. The indictment, which was filed October 26th, accuses Kenya Valboza, a certified coder and former director of Medicare Risk Adjustment Analytics, of participating in a scheme to defraud Medicare by falsifying diagnoses that were submitted to CMS and triggered high-risk adjustment payments. So I'm going to add links to these articles so you can read them all. They'll be in the description below.
So remember these things when you're thinking about Medicare Advantage versus original Medicare for 2024. This is the time that you are allowed, if you're on Medicare Advantage, to either switch to another Medicare Advantage plan or go back to original Medicare. If you choose to make that switch back to original Medicare and want to enroll in a Medicare supplement, also called Medigap plan, there are underwriting questions in most states. And yes, this channel is covering the world. So in almost all states, there are underwriting questions. If you've had Medicare Part B for 6 months, there are health underwriting questions for you to either be approved or denied for a Medicare supplement, also called Medigap plan. There are states that have exceptions to what I just said, because I've seen comments, and yes, California has a birthday rule, Oregon, there's states that have special enrollment periods. If your health status is not what it needs to be for a health insurance company to approve a Medigap plan for you. Feel free to go online to our site, medigapcares.org. You can schedule a free 2024 Medicare review, or you can give us a call. I want to thank you for joining me today as we conclude this deep dive into the intricate landscape of Medicare Advantage. Remember that staying informed is the most important thing. And if you find this information valuable, please don't forget to share it with your friends and hit subscribe and that like button. It will get this message out there. Until next time, stay informed and be well.